Hi, everybody. I'm Dr. Stephen Phillips, and we're just smiling because we've had a couple of takes here. And Dana, introduce yourself, please.
Hi, I'm Dana Parish, and we're giddy. It's late, and we've been at this. We've been at this, and we've had some moments.
Some magical moments and some silly stuff. So we're trying to talk about MS and the relationship to chronic infection. And Dana, I know you have questions about this topic, and your questions usually reflect the question that's the burning questions of everybody. So why don't you just go ahead?
Yes. Well, the first time I met you, I learned that MS had potentially a cause, which could be an infection like Lyme disease, and that there was a lot of literature dating back 100 years that found infections in the brains of people with MS. And that is a fascinating thing to learn. And I want to know about your experience with this. And is it all true? Is it legend? And can we talk about some cases?
Well, okay. So let's just, just for people who are not familiar with multiple sclerosis, MS, we should just define it a little bit. It's a descriptive diagnosis, really. Descriptive meaning it doesn't, by saying that somebody has MS, you're not telling the person what's causing their symptoms. It's just describing the features of the illness, which are typically relapsing and remitting neurologic symptoms, but sometimes kind of a more progressive presentation. So they divide it into primary progressive and relapsing remitting, which is the most common presentation. And there is a definite epidemiology to MS, like there's something suspicious about MS. So there's always been these clusters of cases, and there seems to be a genetic susceptibility to MS, but there seems to be an environmental trigger upon a backdrop of hereditary susceptibility. So Asians don't really get very much MS at all, whereas Northern Europeans get more MS, and Black people in Africa don't get much MS. But when they start to emigrate to Western Europe and to the United States, they start to get MS, but it's about a 10-year lag period, implying that there's some exposure that's really causing the illness rather than just simply genetics. And you're right that even about 100 years ago, there was evidence that they found spirochetes in the brains of MS patients, and spirochetes are a type of spiral-shaped bacteria. Lyme is one of the famous spirochete bacteria. And
so is syphilis. We always forget to talk about syphilis being one that came before.
Right. So they didn't know what this spirochete was that they found in the brains of MS patients. All they knew is that it wasn't syphilis. And so they actually called it Spirocheta melliflora, which means, I think in Latin, myelin destroyer. Myelin is the insulation around the nerves. And so patients, when they get a diagnosis of MS, the diagnosis can be supported by a lot of features. They can have lesions in the brain and spinal cord or inflammation of the optic nerve called optic neuritis. People can have oligoclonal bands, which are antibodies in the spinal fluid against brain proteins. And people can have high IgG synthesis rates. People can have high protein, high white counts in the spinal fluid. And people can have positive evoked potentials, which are electrodiagnostic tests to show that the nerves aren't functioning properly. And the thing is that all of these diagnostic tests used to support and make a diagnosis of MS are also seen with Lyme. So there's a bunch of articles saying that, wait a second, Lyme could be clinically indistinguishable to MS, and how does anybody really tell the difference? And sometimes they tell the difference based on Lyme tests, which are notoriously bad. And it should also be known that there are many strains of the bacteria that cause Lyme, but there's also many cousins to Lyme bacteria that will never test positive for Lyme. It can do the same thing. So, for example, in the Northeast, there's another spirochete called Borrelia miyamotoi. Throughout the southern United States, there's Borrelia lone starri, there's Borrelia bacilli, there's Borrelia mayonnaise. And all these Borrelia, they don't test positive for Lyme, but they do basically everything that Lyme does. So these
But there's no test at all, just to be clear.
For miyamotoi, there are some tests, but there just became a test available at Quest, for example, for miyamotoi, but before that there wasn't. But for bacilli, I'm not aware of a test. For lone starri, I'm not aware. Mayonnaise, there is one through the Mayo Clinic. But generally, these tests are hard to come by. And there are epidemics of Lyme-like illnesses around the world. There's a big outbreak in Brazil of a Lyme-like illness. It's not technically Lyme. So it's just a very, big, like a rose banner in the name kind of a thing. And to exclude the possibility of these infections because the Lyme test is negative is kind of excluding a lot of potential infections is the point. You say, how do you make these diagnoses? It's not easy. You have to do kind of supportive testing. And for example, if somebody tests positive for Ehrlichia, the tests for Ehrlichia are much easier than the test for Lyme. And the test is positive. Well, Lyme is more common than the other kind of co-infections all put together. So you can use that as a surrogate marker of Lyme exposure. So there's little
I
tricks.
see. That's interesting. But most doctors don't even test for these other infections, let alone even think about Lyme when they see MS. I know so many patients who have fallen through the cracks and have gone on for years and got a Lyme diagnosis for some other reason, and then recognized that their MS may have been related or was related.
Well, we had a patient that you met that had a similar
Yeah.
situation.
Yes.
So the
Just
patient that
thinking
you met,
about him.
yeah, had Lyme before his diagnosis of MS. It was something like 5 years later. He had this rash, Lyme rash, erythema migrans. And then
Right.
about 5 years later, developed, subacute neurologic symptoms, which were severe. And they had an MRI, and he had like 40 brain and spinal cord lesions. And the
Wow, that
doctor's
was
diagnosed with
crazy.
MS. And he begged him for antibiotics. Neurologist begrudgingly gave him minocycline because both minocycline and doxycycline have been published to be beneficial in MS.
Yep.
And he got really good benefit from it. And then he took him off and he got worse.
I wanted to see if you could back up a little bit before
Yeah,
about the data about antibiotics.
sure. So there are several, they're pretty small studies showing that tetracycline class antibiotics are beneficial for MS. And they've had some studies even when people were failing standard MS treatments like beta-seron and steroids, and things like doxycycline were helpful. And they've shown benefits in reducing disability scores, brain lesions, brain atrophy. A lot of these
Amazing.
findings were statistically significant, and some were like on a trend towards statistical significance. And you say, what does that even mean? It means that when they do small studies and they find a trend towards significance, that if they do a larger study that has more power, those trends tend to be manifest and become statistically significant. It's like remdesivir. It didn't show statistical significance towards survival with COVID, but there was a trend toward it. And if they did a study that was twice the size, or if they would have treated 2 days earlier, maybe it would have shown a mild, improvement in the outcomes. So in my experience in patients with relapsing and remitting multiple sclerosis presentations, when we find evidence of spirochetal infection, these patients have a good response to antibiotic therapy. In patients with primary progressive MS, it's usually the opposite, unfortunately. Patients are very hard to treat who have that. I know that Selma Blair, her presentation, people always say, like, why doesn't Selma Blair come? We don't encourage primary progressive MS patients to come see me because the outcomes aren't great. Have I ever treated a primary progressive MS person and got them better? Yes, I have, but it's like pulling teeth. And 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 we don't, like I said, we don't encourage them to come in the office. And sometimes people slip through and they just show up, and we don't turn them away, but we don't really say that we can, we don't, not overly optimistic about primary progressive, but we are cautiously optimistic about people with relapse and remitting because most of them do improve significantly with therapy.
I think it would be important to talk a little bit about the term relapse remitting because it's a hallmark of Lyme. And I hear this all the time from people where they feel really great and then they feel really crummy for a period of time. That's what happened to me. And they might then feel good for a while and then they sort of say, oh, I forgot about those other symptoms. And then boom, everything sort of explodes.
Right.
But I
Well, this
think
is
that
yeah. Sorry, this is what happens. Like when that patient we were just talking about, the guy who had the erythema migrans before his MS, when he'd improved on the antibiotics, is hard for the doctor to accept. And he said, well, relapse and remitting MS, improves on antibiotics. I had a patient who was a doctor, a different patient that you don't know and never met, is a doctor, and he was followed by a large Ivy League MS clinic that I won't name. And we documented his responses to antibiotics and his relapses whenever he would go off. He was very conflicted. He was between me on the one side saying that Lyme is causing this, and this large, medical center saying that it's not related. And he had 5 times that I treated him where he improved markedly, took them off based on his neurologist's recommendation that there's nothing to do with it, and showed how he went down 5 times. And
Wow.
they basically said that each time was coincidence, and because of his relapsing remitting nature, he just happened to remit every time he was treated by me, and happened to relapse every time he ended up, going off the treatment based on the recommendation.
Mm,
So that was not great. But the patient that we were talking about before did improve markedly with therapy, thankfully, and
mm,
got him off disability, and he went back to work full time. He wasn't
yeah.
cured. He had a really, really tough case. But, I do think that when the infection has been around in the brain for a long time, I don't like to paint an overly optimistic, rosy picture of things. These are hard, infections to treat, but they're not impossible. Like people like to say, or like to ask the question, is it hopeless? And I'm like, it's not hopeless, but it does suck kind of. These aren't, rosy, amazing, easy to treat things, but in many cases they are treatable, and patients
Yep.
can come off disability and come off immune suppressants and really, markedly improve their quality of life in just such really significant ways that
Yeah.
people should know about it.
I agree. I mean, when I met that patient, and I had only heard his story before because I wrote about it when I interviewed you for the Huffington Post prior, and I was shocked by how great he looked,
Yeah,
and
he looks great.
how
Yeah,
well he told me that he felt and how sick he was and how far he came.
yeah.
Okay, so I don't want to forget. I've got a couple burning questions for you,
Hmm.
which I'd like to ask. So one of the things that I found so interesting was at some point you shared that there is a map that where MS and Lyme overlap on this map. And can we talk a little bit about that? Because it is kind of an amazing, shocking thing to see for the first time.
Right. That's a map that was put together by a statistics student,
Hmm.
and they looked at deaths from MS versus deaths from, they call it arthropod-borne infection, which
Uh-huh.
is, vectors, insects, and arachnids. So
Hmm.
basically bugs that bite
Hmm.
people and spread disease.
Yeah. Yeah.
And so they overlap. They looked at, by county throughout the United States, and it overlapped in this very eerie way. There was so much MS and so much of the disease caused by, vector-borne infection on both, coasts. But in the middle of the
Mm.
country where there's relatively less, you could really see how it stood out. And county by county, in this really creepy way, it overlapped in the middle of, you wouldn't expect a cornfield in Nebraska or somewhere, just in the middle of
Yeah.
nowhere, that
Right.
just a bright spot, and you can see the shapes overlap exactly. And you know that there's something really, really significant about these two
Wow.
maps. So
Wow.
people can search that. They can just type in on Google Lyme MS map, and I'm sure it'll pop up.
Yeah, it's pretty compelling.
Yeah.
Why do so many women who give birth, um, they were maybe healthy before, they felt healthy before they gave birth, had a healthy pregnancy, and then they get MS after they give birth? What's going on there?
It's not just MS, but the immune system is suppressed during pregnancy, and then it
Or
spools
we should
up.
say autoimmune. I'm sorry.
Yeah,
We should just like make it broader because you're right. It's more
right.
autoimmune
So the
disease.
immune system just revs back up around the time that women give birth. And, people with, quote unquote, autoimmune illness diagnoses tend to feel much, much better when they're pregnant because they're immune suppressed. It's like they're taking steroids for 9 months, or
Huh.
let's say 8 months. And then in the ninth month, the immune system starts to rev back up,
Uh-huh.
and women with these illnesses. And in our book, we go over books called Chronic, and we call it Chronic for a reason, because we go over the chronic infections that are out there that contribute and cause a range of chronic illnesses. And
Yep.
it's coming out February 2021. And
Yay.
so we look
Finally.
at, obviously Lyme and Bartonella, and, the more common ones everyone's heard of, but
Hmm.
many other infections that most people don't know about that can cause chronic illness as well.
Yes, exactly. And I think it needs to be said that doctors are not taught about looking for root cause in medical school. Like I get a lot of emails and messages from people who say like, I went to the best, I went to the Mayo Clinic, or I went to Penn, or I went to this. Hi,
Hmm.
Lucy. My doggy just popped up. And what happens what I try to explain, and it's so difficult for people to really understand, to really grasp this, is that all the medical schools are teaching the same basic stuff. Like, they're not ever teaching you that MS is infectious, are they? Or RA or
No, nothing.
fibromyalgia?
No. There's a really hard and fast dogma that these diseases are mysterious and you palliate. You just treat for the symptoms.
Right.
I think it's reinforced by pharma because it's a lot more profitable to palliate symptoms in the lifetime of a patient than it is to find a cure for these illnesses.
Yep.
And really, it's a better course to get at the cause than to just treat the symptoms. And sometimes you
Right.
have to do both for a while, but
Right.
hopefully as the cause kind of diminishes, then the symptoms diminish as well. And,
Yeah.
these lifetime symptomatic therapies are no longer required.
Right. Well, one thing that we learned in the course of writing our book that I don't think we didn't know it earlier, but that we really dug into was there's no money in cures. There's a lot of money in keeping people chronically ill, keeping them on immune suppressants, keeping them on psychiatric drugs,
Right.
keeping them coming back. I mean, I actually am thinking about a story that we had in the book of a friend of mine who had psoriasis and went to his dermatologist and said, I actually recognize now, because I went to see a Lyme doctor, that it was Lyme Bartonella, and I've been on Doxy, and my psoriasis is better, so I want to wean off of the immune suppressant, because it had really just kept his psoriasis from getting worse, but it actually never cleared up. It just sort of stayed at a certain level.
Yeah,
And
I think it partially improved it, you would say,
okay,
like
maybe a little,
50%. But
yeah,
the take-home message, the antibiotics were a lot better and a
yeah,
lot less risky. There's no
exactly.
comparison between the side effect profile of the biologic immune suppressants that he was on compared to the antibiotic therapy that he was on. There's
But
no
the doctor got
comparison at all.
mad.
Yeah, no,
Right. But I
doctor got
wanted
mad.
to, the
Yeah.
doctor got enraged with him and said, this is insane. Like, you can't get off. And um, my friend did get
Right.
off and did really, really well. I mean, he weaned off slowly. So didn't just
hmm
like go off that day. He'd been on Enbrel for like 20 years or something like that.
hmm
But it really is disturbing. The reaction of the doctor honestly, he was shocked, and I was shocked hearing about it. I don't know if you if you were that surprised, but I have not really
No,
heard I've not really heard that many stories like that before.
I've
It
heard
was,
a
have you?
million gazillion. Oh yeah, of
Yeah.
doctors reacting with anger when their
Yeah.
paradigm is threatened.
Yeah.
Millions. So many times
Well said.
I've
Well said.
had patients leave their doctors crying. I had
Yeah.
a neurologist that I know who the patient said that there's a female neurologist that she banged her fist down on the table and said,
Wow.
like, I will not hear about this anymore. There is no such
Wow.
thing as chronic Lyme.
Wow.
And the patient left in tears
Right.
because it invalidates your personal experience. You say, are you telling me I'm crazy? You're saying that
Yeah.
my experience, it's a very intimate experience. When people go through a chronic, severe, life-changing illness, and then they respond to a therapy and improve, and then you go back to the doctor thinking, so happy to share this with my doctor, my team. I finally found something to help me after all these years. You go back and they like shake their fist and pound the table. You feel completely defeated and betrayed and all these crazy
Yeah.
emotions. It's
That's
just
true.
nuts. So yeah, I have a very, very short patience at this point for idiots. I'm not kidding.
Yeah.
I used
Yeah,
to
I
be
know.
like very kumbaya and like give everybody a chance. I'm
I
not
didn't
that
know you
way.
back then.
I'm not that way
I don't know
any.
what you're talking
I'm
about.
not that. You know me now. I'm not that way anymore. I'm like,
Yeah.
if people are not nice, move on, because you know what?
Yeah.
There's a lot of people who are not nice in the world, and a lot of really really nice people. And why don't we
It's
just hang out with the nice
curiosity.
ones? You know?
I had nice doctors who just weren't curious. I mean, they just weren't that curious. They were trying to figure
hmm
out some way to pacify me, but
Yeah.
it really wasn't earnest. Nobody was digging into PubMed at night on my
Right.
behalf, that's for
No,
sure,
that's
because it would
true.
have been really freaking easy. I mean, I actually ended up diagnosing myself after Googling my insane list of symptoms, and just like knowing this is something outside of my
Right.
body just suddenly attacking itself for no reason. It was so bizarre.
A patient just
Um,
recently said that to me. I started seeing patients in the office again recently, outside. I'm seeing them under a tent.
Yay.
It's kind of fun. It's like a little wedding. And I just hit the computer. I really like it. I mean, I miss people so much. You know, it's great to just be interacting with people personally again. And hopefully when the new antigen tests come back for COVID that are, you know, high efficiency with the rapid screening, we'll start indoor stuff as well. And we're
That's
expanding the
awesome.
telemedicine and trying to get licensed in some states like California, which we didn't have
Great.
access to before. But he said that he diagnosed himself by searching something along the lines of, what do you have when all doctors tell you you're healthy? And then Lyme came up. So something
That's a
along those
good,
lines.
well, yeah, people always tell me, oh, all the tests were fine. Oh, I don't know what's wrong with me. All the tests were fine. The doctor says, it's like, yeah, I know. I've heard that a billion times. So were mine until the
Well,
Lyme
listen,
test.
I'm glad when the tests are fine. It's worse
Of
when
course.
people are sick and their tests are showing serious stuff and they
Of
still can't
course, of
find out what's
course, of
going on with them.
course.
Yeah.
Right. I
So
don't hear from those people. I hear from everything. My doctor says everything's fine.
yeah.
I'm left with Lyme. I somehow got to you or saw, something that triggered my thinking about this in a
Yeah.
different way. So before we go,
Hmm.
I'm sure people are going to have some questions for you about this, and it would be great if they can write in, and I'm sure you'll respond when you have more time. Before we go, can we just talk about the weekend? Because I am super excited about, we are the keynote speakers this weekend on Saturday morning, October 10th, at the Icahn School of
Hmm.
Medicine's Lyme Mind Conference, which is part of Mount Sinai in New York City.
Yep.
Of course, we'll be doing it online. You want to
Yes.
talk about registering and all
Yeah.
that
So you go to
stuff?
limemind.org. It takes 2 seconds. It's completely free, unlimited capacity, obviously, because it's virtual. It's a huge honor. Did you mention the Cohen Foundation that's sponsoring?
No, I completely forgot.
Thank you so much to the Cohen Foundation for your generous sponsorship of this event. And it's a
Yes.
really popular event. It's usually
Once
packed
again.
every year.
Yeah.
So the fact that it's virtual opens it up to everybody, which is if there's anything good to come out of COVID, this is one of the rare good things that it'll be open to everyone. And hard for the West Coast people because it starts at 6:30 West Coast time. Oh
Yeah.
well,
Hello.
at least
I
you have a
know, I just
lime
got
tree
the email.
in your backyard. So yeah, it's kind of coincidental. A little jealous on my part, I have to
Well,
say.
it gives you a reason to get on a plane and come visit. You can
Yep.
pick some limes from my tree.
Hmm.
So yeah, please send us questions because we're going to have a live Q&A during the conference. And once you're registered, I'm sure they will explain how to send in a question. And we'd be very interested in hearing from you because you guys always send us great stuff. And, we're going to keep coming back here and doing these. We're going to bring some other people in to be interviewed. And I want to talk to some of your staff actually, because I've got questions for
Well, that'll be
all
fun.
of them. So
Yeah.
I think it would be super fun. I've been thinking about it.
Yeah.
So I'm,
I
I'm
think that would
glad,
be
I'm glad
fun and funny.
it
Yes.
would be fun and funny, but you
They
have,
get the giggles quite often. I think we have a lot of takes, trying to interview the people in my office.
you are surrounded by some sassy ladies. Let's just be honest about that. You
Smart
have
and
some
sassy. Yeah.
super smart and
Yeah.
wonderful.
Yeah.
I
We like
love,
them
I
quite
love
a bit.
all of them.
Yeah.
I love all of them. So I think that would be fun to do that next
Okay.
time.
That would be super.
Okay. Well, thanks for being with us tonight.
Thanks, everybody. Wishing everyone good health and safety. And
Yeah.
we'll see you next time. Okay.
Bye.
Bye-bye.